We're back with our second segment of the program that always features Dr. Kevin Kavanagh on Friday morning at this time. He's a retired physician and also founder of Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
We don't do this too often, but every now and then I think it's good for the folks who are maybe new listeners to know what is Health Watch USA and how it came to be and how long has it been around?
Well, it's been around over a decade, and it came to be because of a number of concerned physicians and community leaders who were concerned about healthcare quality. And over the years, we have been primarily focusing on prevention of infection disease, both from the patient advocacy standpoint, but also from the research integrity standpoint. We've had a number of peer-reviewed articles in journals and also to hold a yearly conference, which right now is international in scope, and we have a number of international members. So the organization grew from a very small Kentucky community organization to one now that has international reach, and I'm very happy that I've been part of that process.
All right, let's guess the latest thing that you sent me here that came in just a few moments ago is information about school masking policies and secondary SARS and COVID-2 transmission. What is that all about?
Well, that's a new study that's been released. It's been published in the Journal of Pediatrics. This was, I believe, an NIH study. And this looked at a number of schools that had mandatory masking versus optional masking. And what this study found is that there was 3.6 times the secondary transmission rate in schools where masking was optional. And this, I think, is very important because, as you know, COVID-19 usually, but not always, is mild in children. But what we have found out is that children do spread it to their caretakers, and they can spread it to other immunocompromised children or children that have difficulty fighting off infections, such as a child with diabetes. And this kind of underlines the fact that masking does work. Now, this study was performed during the Delta period, so that it may not be quite as effective during Omicron, but as you know, with Omicron, we've advised going up to KN95s or N95 masks. My grandchildren use the KN95 variety at schools. And this is also very important because there is a bill in Kentucky, House Bill 51, which has passed the House, which will ban mandatory masking on the district level. In other words, local districts can't make their own decisions. And I think this is very bad. And from the original bill, it was banning viruses and bacteria for any infection to come in the future. It just wasn't for COVID. So I think that this is concerning, and it does underscore that we've got these issues coming up before our Commonwealth, and people need to make their voices heard.
All right, and anything else on the school masking that you want to talk about?
Well, I think that's the most important thing. I do think when we're in surges, or if we do have a much more dangerous variant, that we need to really not only protect our children, but also protect their caregivers. Many families are multigenerational. In other words, they have grandparents living in the families, and we need to cut down on the spread of the disease. The majority of countries require masking in schools during periods of high COVID transmission. And I hate to say this, Jack, but even with the CDC new guidelines that greatly relaxes definitions of what a red zone is, Fayette County is still in the red. And that's with data that was just posted on the Kentucky Public Health website today.
I understand also that the CDC has extended masking on airlines. Many experts still encouraging mask usage in high-risk areas in Kentucky, over half of the state, as you mentioned in the red. And the CDC extension goes, what is it, till April, maybe, sometime in April?
Yeah, April 18th.
And includes buses and trains and I guess all mass transportation. What do you think about that?
Yes, and I think that's absolutely necessary because remember, you do have people who are immunosuppressed, who are at high risk of getting an infection. Omicron is still out there and at very high levels. They have redefined what a red county is. And that's something people need to take note. You know, before, for example, green meant having 7 or less cases a week. Now it's 100 or 200 cases a week or less. And so that's not real good. It's primarily based on hospitalizations. That is looking at very severe disease. But Jack, as you know, with the recent data that's just been published on neurological manifestations of COVID, maybe having mild disease is something we want to avoid also. So I think this just ignoring COVID and opening up may not be the best thing to do. And when you look overseas, rates are starting to go back up in the United Kingdom. And this, most people are assuming, is from the Stealth Omicron variant, which is highly mutated over the Omicron variant. And in the United Kingdom, cases are up 46%, deaths almost 20%, and hospitalizations over 12%. And that is a warning signal that maybe right now isn't the time that we should fully let up on these public health measures.
This is Eric. Hey, Eric, thanks for holding.
Hi. Yeah, I came in the midst of the conversation for my appointment, but I came in and Dr. Kavanagh was talking about an increase in the incidence of daily new cases and an increase in the daily incidence of new deaths. I'm wondering where he gets his data, because the numbers he's quoted don't match up with the website worldometers.info at all.
That data is from the public health agencies in England. That's the United Kingdom data. That's also recently discussed. MedPage Today yesterday had a big article on it. Deaths are also way up in Denmark also. So that's accurate data. That's where we get it. We download it mainly from the public health agencies for major nations.
Go to confirm that?
What?
For all the listeners, do you have a website that we can go to confirm that data? Because we've been getting told for 2 years
there is.
about all the
Hey, hang on, Eric. He's going to give you the website. Be cool.
Cool.
Yeah, you can go to
Thank you.
Infection Control Today. We have an article in there, and it has the link to the website where you can download the data file. I mean, that's what our organization does.
Why is there so much conflicting information out there? That's what makes this whole thing so frustrating and complicated, you know?
Well, I'm telling you, there's a lot of disinformation out there, Jack. And I've said this all along, that a lot of it is from our foreign adversaries that are fueling this. And I think you're going to see this on steroids. I mean, the same sources that's fueling the coronavirus misinformation, I think you're also going to be finding out they're fairly sympathizing to the Russian stance on the invasion with Ukraine. You've got election misinformation. It's all coming from the same source. People in Russia right now don't even believe there's a war in Ukraine. You can read reports in the BBC of families in Ukraine talking to their families in Russia about misinformation and that there is a war in Ukraine, and they're having huge family feuds over it. It's like talking to some of my family, and luckily they're relatively distant, regarding that the coronavirus is a significant problem. So that is a huge problem. And people, when they get confronted with the truth, just like the caller, they get extremely angry because it undermines, what they've been told. And certainly what we're seeing is mixed messaging from the United States. And I'll be honest with you, with the war going on, I'm a little worried about this, because I don't think any country is going to say they've got a huge outbreak simply because it's a national security issue, similar to what it was in 1918 during World War I. They don't want the other side to know that you're having a bigger problem with the virus than what you're actually stating. And so that may be a factor. So this involves geopolitics. And what really drives me crazy is when you look at the war in Ukraine, one of the aspects of, people aren't supporting the United States or some of the countries in Africa and South America, they're not as supportive as what you think they should be. A lot of that's that they're mad that they didn't get free vaccines from England and Europe and the United States. But yet we have people over here in our country that are mad that these vaccines are being distributed. They think it's just something that is terrible, that they're harming the public. So the misinformation is just unbelievable. But there is data out there, and if you don't believe me that this is a serious pandemic, just start talking to your friends and relatives. Most families at this point have been touched by someone who's still suffering from long COVID or have lost a loved one. Our country has gone through a terrible 2 years. It's been very stressful. And for the most part, we're not doing well with public health advice. We're not doing well with vaccinations. We are 63rd in the world as far as vaccinating our individuals and our citizens. And right now, as we've said with these new variants, the vaccines provide you maybe a layer of armor, but they're not nearly a panacea. But over the last 2 years, they were really working well. And those that were vaccinated were able to avoid a lot of the death and disability that the unvaccinated individuals had to endure. So it gets very frustrating, Jack. And I don't know if it's going to change much. With 1918, 2 years was kind of the cutoff where everybody said pandemic's over and they just ignored the virus. There was a fourth wave with the 1918 flu. It's not talked about much. It's not gathered much. And that's because after 2 years, people just kind of gave up. Unfortunately, with this virus, the data that I'm seeing, even the mild infections, have real concern, and there's still dangerous variants out there. And it's not only in people, but it's in deer right now, it's in rats, and we really need to change the way we're living. It doesn't mean giving up the American way of life, but it means that we probably can't go back to normal, that we're going to have to safeguard our elderly, our frail, and we're going to have to do things responsibly and do things that are based on good science. So I guess that's my lecture on what we should be doing, and hopefully people will start to come together and do that.
And be vaccinated. And what about boosters? I think that's something that's confusing us all.
Well, definitely. Right now with these variants, if you don't have a booster and you're more than 5 months out from your second dose, you probably have not much protection. Similarly, if you had an infection of a variant that's Delta or prior, your ability to fight off these new variants is questionable. And you don't want to get long COVID. As I said before, there is a very chilling study regarding the CNS effects of the brain from the viral infections. And as you know, about 60% of the people, they experience changes of smell and decreased smell, and those people may actually have involvement of the brain with the virus. So this is a disease we want to avoid.
Thank you, Dr. Kevin Kavanagh. I'll talk to you Monday.
Thank you.